Welcome to HFMAtalk, the podcast for NHS Finance. I'm Sarah Day, Senior Policy Manager at the HFMA. Joining me today is Paul Butterworth, Director of Strategic Financial Management at Macmillan Cancer Support. It's an organisation that I'm sure we're all familiar with, but we're going to be picking up a few topics that may well be new to people listening. So welcome, Paul. Thank you for joining us today.
Hello, Sarah.
Thank you. Could you start us off just by introducing yourself properly and telling us a bit about your role at Macmillan?
Yeah, of course. And thank you for inviting me on today. So, yeah, my name's Paul Butterworth. I started out in the financial services industry. Thankfully, this isn't a live broadcast, or I'm sure I could almost hear the boos, but that's where I did my accountancy qualification. I did a number of different roles. I worked out in Singapore for 3 years, leading the sort of setting up the finance function for a new technology centre. When I came back to the UK, I decided I wanted to move into the charity sector. So I've worked for a couple of large charities, CR UK, the NSPCC, and then this role at Macmillan. I also at one point set up a social enterprise, sort of helping small charities with their accounts, which was very interesting. But I've been in this role at Macmillan for close to 3 years now. Obviously, I think Macmillan's a fantastic charity, and happy to talk a little bit more about that. But as for a lot of people, my main reason for joining Macmillan was the personal connection. So I lost my mum in my 20s to she died of stomach cancer. This year I lost a good friend, unfortunately, to cancer. So I'm sure most people listening to this are aware of the statistic, but it's still a statistic that sort of gets me, that 1 in 2 people will develop some form of cancer in their lifetime. So yeah, that's why I'm sort of at Macmillan and in the role that I'm doing.
Thank you for sharing that. It's really interesting to understand a bit behind the person that we're talking to and understand some of your reasoning for doing what you do, which is great. Thank you. So this podcast has come about because we've been introduced by an organisation called Social Finance, and the main area we want to talk about today is social investment and the links between that and the NHS. And we've held a couple of webinars on the topic at the HFMA, but I expect that most people listening probably don't know much about this area. So are you able to explain a bit about what the social investment model is?
Yeah, happy to. And I think, I'd probably just start with sort of what we mean by, or what I always think of as a social investment, which a lot of people will still refer to as a mixed motive investment. So from Macmillan's perspective, it's an investment that both needs to serve our charitable purpose and it needs to make a financial return. In terms of the model that we've developed with social finance, basically there's four steps to it, which probably help if I sort of talk through. But overall, we're looking to invest up to 36 million in end-of-life care services using this model over the next 4 years. So basically what we do is we work very closely, Macmillan, Social Finance and our an NHS trust, looking at sort of system pressures, or what we sometimes also refer to as system stressors. So things like hospital capacity, agency spend or workforce. So where is there a real pinch point that a new service could be brought in to help alleviate that pressure? And we're really looking for quite a specific outcome that we can focus. So in one of our recent investments, that would be, say, a reduction in the number of unplanned bed days. So we identify that sort of system pressure and that outcome. We then look at what that new service is and design that new service. Often trusts will come to us with a very clear idea of what they want to do. It might be an existing service that they want to scale, or it might be quite a new idea. It might be something quite innovative and something quite different. But we will fund the entire cost of that new service. That starts to deliver the outcomes that we set out at the beginning. And then about halfway through the contract, Assuming those outcomes are met, we basically start to get repaid. So it's a social impact bond. It's not a loan, which I could touch on a bit more, the difference if it's helpful, but it's not a loan. It's a bond, and we get repaid if those outcomes are met. And basically, if the service is a success, as we all hope it will be, and the key is we continue to look at those outcomes. It's the outcomes, not really the service model, that we're most interested in, and potentially how can we continuously improve that service to get those outcomes. But assuming everything goes to plan, we'll be fully repaid. We never are paid more than we've made the initial investment. There's no profits, there's no interest. The maximum we can be paid is the amount we invested back. But if the service wasn't fully successful, if it took longer to ramp up, if there were delays, then potentially we wouldn't get all of that money back. We essentially take on that risk on behalf. Yeah, so that's a bit of an overview of how the process works, but there's a number of different elements there, Sarah. I could probably talk on a bit more if you think it would be helpful.
Oh, absolutely. And I've got a few questions that maybe pick up on some of those. But I'm just going to take the last one, almost the last sentence that you mentioned, because a key attraction almost for the NHS for this way of doing things is that as the funder, you're taking on a lot of the risk of the service model not working. Now, why would you do that?
Yeah, good question. Well, essentially, the simple answer is because it's helping to set up a service that's going to help people at the end of life. So that is part of our charitable purpose. That is part of our charitable aim. I didn't really get to touch too much on, all the variety of services that Macmillan does. But we help. We do whatever it takes to support people affected by cancer from diagnosis through treatment and beyond, and to the end of life. Now, so we want to support people. We want to enable services that will help people at the end of life. For us, helping to create that service, and a service that might not be there without this sort of seed funding, this initial investment, that's the key purpose. That's the charitable purpose when we're having to tick those two boxes in terms of social investment. So that's in many ways the main reason. There are other reasons, though, that we would look at this funding method. As you're probably aware, and again, I can come back to it, grant funding is our main source of funding and will continue to be our main source of funding. But we really see social investment as being a secondary sort of key method of funding, especially end-of-life care services, because we think from a systems perspective, actually it's a way we can generate greater system-wide change than we could just through grant funding. So we want to create those services that will help people at the end of life, to provide services that might give them a choice of where they want to, where they wish to die. We want to help those system-wide changes and prove that the model can work, across all 4 nations. There's also the finance angle, as the finance director, clearly if we can create a service that's ticking a charitable box, but that then if that service is successful, we're repaid, then we can use that money to fund more of those services. So we take a portfolio view. We know that not all services will fully repay. There is an element of risk, but there's a lot of due diligence that goes into when we do these business cases, to try and minimize that risk. But taking on that risk is inherent as part of getting these services up and running, especially when there's something more innovative and something that perhaps might struggle to get going if they had to be funded themselves within the trust.
How hands-on are you as an organisation with the NHS trust or organisation that might be looking at doing this work? I mean, you mentioned that people come to you with a variety of different ideas that might be quite well developed or might just be a brand new thought at the moment. Do you have a lot of involvement in how it evolves?
Yeah, quite a lot of involvement. Obviously, in terms of the service itself, that will come from the trust. What ideas has the trust got to support people at the end of life in their area, but especially we're partnering with a not-for-profit organisation called Social Finance, who bring a lot of experience of how social investments can work. So in terms of building that business case of, well, where are those systems pressures? What are the types of things that you would look for? How would you quantify that? Where's the data for that? What's the type of improvements that we might be likely to see over a 3-year period? What are the likely stage gates? What would a reasonable repayment look off the back of those improvements? How do you put an economic value, say, on those unplanned bed days? We can bring a lot of that expertise to that discussion to build that business case. And we very much, again, one of the key things we're looking to do with this intervention, with this fund that we've created, this £36 million fund, is really collaborate and support partners across the system to really develop these services and maintain these services and create exemplar services. I think we've had it said that actually one of the that experience has helped upskill finance teams or the teams who've worked on these business cases, but because perhaps they've not done one of these social investments before, or they weren't quite sure what were the right bits of data to look for. And we've been able to bring that, and our partners, Social Finance, have been able to bring that. So I'd say pretty hands-on, to be honest, in terms of that sort of business case development.
Brilliant. Well, thank you. So I'm going to go back a little bit to some of the techie finance stuff that you mentioned just before we get into some of the projects that you've been involved with. So you mentioned this isn't a loan, it's a social impact bond sort of grant. Could you just explain a bit more for the people who are worried about how this might appear in the books of an NHS organisation? What is this?
Yeah, thank you, and good question. So as I think I mentioned, it's definitely not a loan, and obviously the big difference there really is that there are no interest charges. So Macmillan funds the costs of the service up front, and the amount is only repayable if the outcomes are successfully achieved, and that's capped at the cost of the service. So actually any excess benefit is retained by the system. In terms of accounting for it sort of within the NHS trust, actually usually contract size is generally fairly immaterial, but the Integrated Care Board might accrue the potential liability to make the outcome-based payments as a way of ensuring that those potential outcomes, that liability, isn't forgotten.
I think you've sort of answered this question. So one of the questions I was going to ask you was, Macmillan already worked closely with the NHS in a lot of areas, and so I was interested in why you then chose this model and going through sort of that third party with Social Finance to do this work. But I guess that link with the outcomes and the experience that Social Finance bring to this around social investment really makes this quite different from your other work where you're directly contracting with the NHS, perhaps.
Yeah, there's. I was surprised when I joined Macmillan at the variety of services that we do provide, from direct grants to individuals, and support line for individuals. But a big chunk of what we do and what Macmillan is obviously quite well known for is the cancer nurses, is the health and social care professionals that we typically fund through a grant, typically for 2 to 3 years, with the expectation that the partner organisation will sustain those posts going forward. And that's a model that has served us very well. That's had a huge impact in terms of the people that we've been able to support who are affected by cancer. But we do see this as a really great sort of secondary funding mechanism that we're really looking at in this end of life space in particular at the moment, sort of proving it can work in this space. Whilst this 36 million fund is relatively new, actually working with our partners and Big Society Capital, this is something that we've been involved in since 2015. So there's a number of social investments that we did through that through that previous fund, 7 previous investments, some of which were very successful, and we helped up to 10,000 people sort of through that model at the end of life. So yeah, we've had quite a lot of experience in this area already with our partners social finance, but this is something that we're looking to bring a bit more in-house, make it a key part of how Macmillan funds services going forwards.
So have you got any specific examples of some of the successes that you mentioned there?
Yeah, what would be some good examples? So yeah, I know, of those seven services that we funded previously, so alongside Big Society Capital and social finance, one of our big successes there was a rapid response nursing hub in Hillingdon, and that was nominated actually for a HSJ, a Health Service Journal Award. I think you're aware, and I think you've done a webinar on one of our most recent investments from this year with the Oxford University Hospitals Trust, OUH. So a sort of a rapid response project with OUH, Sobel House Hospice Charity, ourselves and social finance. And that's a 6.1 million funding from Macmillan to OUH, up to 6.1 million. And although that only launched earlier on this year, we know that's helped already 230 people who've been cared for in their own homes as being their choice of where to die. So, and I think, as I mentioned earlier, those previous sort of 7 projects, they've impacted 10,000 people. So yeah, it's an area we're really proud of.
Brilliant. So through all this work, have you noticed key things that need to be in place in an organisation in order for this to work?
I think there's definitely some things that improve the chances of success for sure. So I probably feels like I've gone on a bit about it already, but those clear outcomes, that is key right at the start of the process for everyone to be agreed on what is the tangible outcome that we're looking to change. Okay, it's unplanned bed days. They make a difference. You may not be able to. This may not be about closing beds, but hopefully it may stop you having to open more beds, or even having to stop opening a new ward. So that those type of changes that at the edge can make quite a difference, certainly from a cost perspective. So what are those outcomes? And obviously I'm a finance person. I'm a touch focused on the finance. There's lots of service. There's lots of service KPIs that we look at and that we work very closely as well with the partner. But being clear on what those outcomes are from the start, pulling together an evidence base of what that looks like and how we're going to monitor it going forwards. I think that can be everyone looking to sort of monitor and measure that success can be really important. It is quite data driven. So I think getting all the teams together, the finance team, say the business intelligence team, obviously the clinical team, is absolutely key to these services and the success of any of these services. But having everyone on that same page from the beginning, I think, can make a real difference. I think the finance, obviously I'm speaking, I think, to a largely finance audience. I think having, the finance team is really key in terms of that funding model and that repayment model. So having that team bought into it, going on that journey in terms of, well, how are we going to calculate this? What is it that we're going to monitor? How do we see that cost avoidance? How can we justify this service on an ongoing basis? We believe in the benefit. If we can see these benefits genuinely coming through, then we believe it's a service that's going to continue. I'd say that's really important. Getting all those teams together and on the same page from the start really helps.
Great, thank you. So from a finance point of view, I was thinking this through earlier. it could be argued that perhaps Macmillan is funding the NHS to deliver services that it's already funded to do, which might be difficult for you to deal with in terms of your charitable purpose and justifying investment with your trustees potentially. And I just wondered, how do you approach that as the funder of these projects?
Yeah, I think that's a good question, and there's probably maybe certainly two elements to it. So, I think that there's probably a very broad question there, almost from a charity sector perspective. Are charities funding or providing services that someone else, the government, local councils should be providing? That's probably quite a big, broad sector question, and I'm sure some people would have some strong views on it one way or another. I don't think I necessarily have too strong a view on it one way or another, that very broad question. I think in terms of what we're doing here and from our charitable purposes, as I said, key is that we're helping provide services to support people at the end of life. I think we really see ourselves, I guess, as a bit of an enabler in this. These are services that potentially often trusts want to do. They've got the idea that they want to do them. They might have started them already and they're looking to expand them. They want to go weekend or out of hours, but actually getting that through the internal processes when resources are scarce, where funding is scarce, where there's a risk involved in it. If we can sort of step in and provide that short-term funding to prove that service can work, to actually work with, as I say, the finance team and the clinical teams to help continuously improve that model that's delivering those outcomes, to make it a better service, so it's got the best chance of, after those 3 years, being maintained on an ongoing basis, then that's absolutely something that we see as being within our sort of charitable purpose, and that our leadership team and our trustees are very happy for us to be operating in this space and to be proving the model can work, as perhaps part of a wider system change, and proving it can work in the 4 nations as well, not just in England.
Thank you. Yeah, you're right, there was a bit of a philosophical question thrown in there, but that was a great answer. Thank you very much. I wonder if we could just move away a little bit now from the social investment side and just talk a little bit wider about some of the work Macmillan does. And cancer is obviously a key focus for the NHS. And I'm interested how organisations such as yourselves feed into national planning in this area and help develop some of the strategies that we see coming out of the centre.
Yeah, well, at Macmillan, definitely, I wouldn't claim this to be necessarily my area of expertise, but one of the things that Macmillan certainly does is help sort of develop or challenge some of those national cancer strategies. So one of our main roles is to advocate on behalf of people with cancer for better sort of diagnosis, treatment, support. We do that by working with the governments and healthcare leaders across all 4 nations. Last year, we ran what we felt was a pretty successful sort of Forgotten Sea campaign. As your listeners will know even better than me, the aftermath of COVID, increased waiting times for a number of services, making sure that cancer wasn't that forgotten sea. We, very much were pushing that agenda, and we're working with each nation to ensure that plans are in place to reflect the needs and experience of people affected by cancer. And obviously, we want to make sure that there's the necessary funding and leadership in place to drive that. In truth, though, the NHS is a big organisation. Healthcare is a big issue. It is bigger than Macmillan. We like to think that we are able to and do influence in that space. And I think one success would pull out that I guess relates to this is, social investment is now included in the NHS commissioning guidance.
Yeah.
So the NHS palliative and end of life care funding and contracting approaches. So how social investment can be used, can be an efficient use of third sector funding. So again, we believe we have an influence sort of in that area.
Oh, brilliant. Thank you. And you've touched on this, I think, already, but so our audience today is mainly NHS finance staff, and we can sometimes feel a bit remote from patient care. And I think you've referred to that a couple of times as you've been speaking. And obviously, our financial decisions have an impact on patients. But do you see any specific role in addressing the current issues around cancer care for finance staff? Is there something you think that the NHS finance function could be doing to help improve some of that backlog, or think about how cancer care should develop?
Yeah, well, I've probably got sort of two answers to that in terms of, I think NHS finance staff, so your listeners, and I think obviously I'm a bit biased, but like all finance staff have a really critical part to play in their organisations. I think, we can bring that financial rigor, that cost control, but combining that with the sort of strategic support, the business insight, I think is hugely valuable to any sort of management and leadership team and setting of the future strategy. So I'm sure what your listeners do every day is absolutely making a difference to patients within the NHS. I think with regards, more directly regards sort of today's topic, I guess it goes back to that guidance almost. I think it's just making sure that people are aware that they're, to consider a different mix of providers. So be that community or voluntary sector organisations like Macmillan, in terms of responding to the needs of people with cancer and of the system. So considering sort of working with us, be that grant funding, be it social investments for end of life care, having those different avenues, being aware of those different avenues, perhaps bringing that to the mix when the conversation is ongoing. How can we improve services and add more value and save a bit of money? I think that's a winning combination that most leadership teams are open to. So I think your listeners can certainly bring that insight. I'm sure it would be welcomed.
So just going back then to our main topic of social investment and improving end of life care, what would you say to anyone who's listening who's undecided about whether they should get involved or not?
Yeah, well, I think if anyone's undecided, I would just, I don't want to give too hard a sell. I was never very good at sales, but I think if it's something that you have an idea of, or would like to find out more about, then simply I'd say just find out more about it. You can get in touch with us. We have an email address, socialinvestment@macmillan.org.uk. So I think there's a real, for me, when I started this role a couple of years ago, I hadn't particularly come across social investment, but it didn't really take too much of a sell from my perspective to be a supporter of it. Ultimately, if we can fund services that are going to help people at the end of life, and potentially there's a mechanism that will be, if the outcomes are met, will be repaid, so we can fund further services, that feels like a win-win from my perspective. I think from a trust's perspective, if you've got a funder willing to take on the risk, if you've got a service that you want to get up and running that you think is going to make a difference, going to improve things in your area, you've got a funder willing to work with you on that, hopefully help improve that service, improve the business case behind it, tighten some of the analytics, really demonstrate the value, and is willing to take on some of that risk in those first years to get that service up and running, that feels like there's a bit of a win-win to be had there. So yeah, if you're thinking about it and would like to know more, I would simply say, yeah, please continue that journey and look to understand a bit more. And if we can help with that, then reach out to us.
That's brilliant. Thank you, Paul. Thank you so much for your time today. I've certainly learned a lot, and I've really enjoyed talking to you. So thank you. As I mentioned at the beginning, and as I think Paul mentioned on the way through, the HFMA has recorded a couple of case study webinars on this approach, and you can access them through the events archive on our website.
Thank you for listening to this episode of HFMA Talk, and don't forget to subscribe to this podcast to keep up to date with future episodes.